Welcome. Come on in. Welcome to the after hours VIP tour of the University of Iowa Urology Department. My name is Charlie Paul. I'm one of our fourth year residents currently on night float, which is something we all love about our program here. We're going to give you a little tour about our facility that is at the main university hospital here, the University of Iowa Hospitals and Clinics. This is really the mothership of our residency program, of our urology department, and really kind of our headquarters. We have a lot of different things going on here. The first is a clinic. So it looks like a normal clinic waiting room, front desk, etc. Our clinic that you'll see here in a second is well set up for doing a lot of in-office procedures, a lot of cystoscopy, fluoroscopic procedures. Behind our clinic, you'll see our own urology dedicated operating room suite. And additionally, we have all of our offices here. So our resident offices, our faculty attending offices, and then all of the offices for our support staff, our nurse coordinators, our secretaries, etc. So let's take you back to the clinic. Plenty of space here for multiple providers to be running clinics at the same time. A lot of great support staff who are really knowledgeable about the types of procedures that we do in clinic, and especially just the urology specialty needs that we have and that may arise. We'll take you back now to show you just a couple clinic rooms. It's kind of our workspace here on the right where we would set up shop for a day of clinic, and then pretty standard clinic room setup here. We'll take you right in just a minute to see our operating rooms, but first we'll take you back and show us our offices. Welcome to the Urology Resident Workroom. This is really the central hub for our urology life. We typically all start the day here together. We end the day here when the day is done. And it's really great. We have one room where we can all be, but we still have our own dedicated workspaces. There's a nice flow kind of moving around the edge here where typically our chief residents sit on this side of the room, our senior residents, and then junior residents on the other side of the room. You'll see a lot of good memorabilia as we go through. Certainly our white coats, well used here. I'll take you around where I'm spending my time these days. I'm one of our fourth year residents, which is one of the times that we do our night float rotations, and so filming this at night, this is where I spend a lot of my nice alone time here at night. And so some beautiful Iowa City, Coralville scenery. We all have, as I said, our own workstation with 2 monitors, plenty of secret hiding spaces, plenty of storage options for the essentials like a tuning fork that's probably never been used, and a lot of Eurojets. We love the proximity of our workroom to all the places we need to go within the hospital. So if you're doing major cases, open, lap, robotic cases, they're 2 floors, straight up a stairwell that's right across the hall. If you need to go see a needy consult, it's 2 floors down, straight to the emergency room and the main entrance of the hospital. But there's also a great coffee shop, cafeteria, etc. Even better than that is we'll take you right down the hall where you're really just seconds away from our own urology operating rooms. So we'll head there next. Hopefully you got the sense that that distance is not far. So you've arrived at our own urology-only operating room suite. So to get a sense of what a day in the life is when you're covering these cases, usually these rooms are run by our second year residents. Periodically they're run by more senior residents, but it's really primarily endoscopic in minor cases here. But that being said, it's all ranges of endoscopic cases. So PCNL, large, extra large TURBTs, also a lot of smaller, quicker cases, ureteroscopy, stones, etc. We'll continue on with our theme of proximity, where the operating room is right up here on our right. We've got everything that we need to do full host of endourology here. Our fluoroscopy, any number of scopes, resectoscopes, and all of our equipment over there. We have an anesthesia team who staffs these ORs every day. It's usually a CRNA or a resident as well as an attending anesthesiologist. And one of the things that we really love here is that all of the support staff, all of the nurses, the scrub techs, they only work here and they only do urology, so they really know what they're doing. At the end of the case, you'll notice that we open up right into our PACU. And so it's 10 feet from the operating room to where the patient will recover in PACU. We have a full PACU nursing staff here, who's also, of course, overseen by the anesthesia team on a daily basis, so patients can recover before they're either admitted or before they discharge. So we have 2 operating rooms here. The one you were just in. You'll notice we are also very well supplied with irrigation here, as a good urology program must be. And then this is our second operating room. A little smaller than the first, so take a left turn into our more academic hallway here. If you would take a left, our conference room is right there. That's where we have a couple conferences each week. Monday is always an indications conference. Tuesdays is usually a teaching conference put on by the residents, and then a variety of different conferences following that, either M&M, Grand Rounds, or a different type of educational conference. And then off to our right is our faculty attending office hallway. So if we need to stop by, chat with one of our attendings for advice on a clinical situation, to talk about a case that may be coming up, or to debrief about a case we just did, they're right here. It's very much an open door policy. They're always happy to have us stop by and talk through whether it's a personal or professional thing. They're really always there for us.
For the next leg of the tour, we'll move from the main university hospital, which you're seeing straight ahead, over to the Iowa City VA, which you're seeing just come into view there on your left. The VA is located just down the hill, so we'll take you on the short walk across the street. The VA rotation itself is set up with a fourth year acting as the junior resident, and then a sixth year resident who is the chief resident there. So we'll take you inside to see a bit more.
Hello, I'm Kevin Flynn, one of the Urology Chief Residents here at the University of Iowa. I'm going to give you a quick tour of our VA facility. So, just down the hallway to the left, we have our, this is our workroom where we hang out and kind of workstation with your co-residents. Here's a patient waiting room, and then there's several clinic rooms down this hallway. Then we'll take a tour down this hallway, where I'll show you a couple of the procedure rooms that we have available. So, it's kind of a lot of storage computers now, but this is typically where the urodynamic studies are performed, which as the VA chief you do all the interpretation and kind of finalization of the diagnosis on those studies. And then coming down this hallway, we have a few additional procedure rooms. In here is the cystoscopy room, where as a fourth year you run your own cystoscopy clinic, doing all of the new microscopic hematuria workups as well as all of the existing non-muscle invasive bladder cancer. Really great opportunity to hone your skills and start making some clinical decisions independently. Over here is another cystoscopy room, and then just behind us, it's locked, but this is where we would do trust biopsies, where that's where as a chief resident you basically run the trust biopsy clinic and do probably anywhere from 4 to 6 of those per week, and then do all the subsequent patient counseling on your own. A few other things I think are pretty advantageous about our VA setup is kind of how everything is essentially located. Kind of just behind where we started is our intensive care unit, so anytime you have some critically ill patients, they're just around the corner. Additionally, all of the standard inpatient floors just one floor up, so again, not too far. Then we have a dedicated endo-urology suite. We're the only team that operates there, and so it's consistently stocked with all of our own equipment and where we do all of our endoscopic procedures. In addition to that, there's obviously several other main operating rooms where we do our larger cases. I think in general the VA is a great experience, gets a lot of kind of take the things you've learned earlier in residency and begin to practice that autonomously while taking good care of the vets.
Next up on our tour today, we'll head back up the hill to the main university campus, but shift our focus from the adult hospital, which you're seeing there on your left, over to our children's hospital on the right, the location of our pediatric urology rotation.
Hey guys, my name is Courtney. I am one of the PGY5s. I graduate in 2022. This is our children's hospital. So we are on the 12th floor of the children's hospital. It is the top floor. You get a great view of the city and of our Kinnick Stadium. So this is the football stadium. Obviously you get a fantastic view from up here, and this is where the famous wave happens, where the stadium all turns around between the first and second quarters and waves at all the children who are up here. So it's actually a very exclusive place up here, where only if you work here, if you're a patient here, can you get up here. And especially during game days, really only patients are allowed up here. So it's a really beautiful place to be. I will also talk about our PEDS rotation. So PEDS rotation will happen during your PGY4 year, and that you get 4 total months of PEDS, where it's broken up into 2 2-month blocks. And it happens at the beginning and at the end of the year, so you get it kind of throughout that PGY4 year. You cover, so there are 3 PEDS faculty, and you cover everything. So you cover the inpatients, the consults, and all of the cases. And it's really a primarily operative experience. So you're operating basically every single day with a clinic maybe here or there. So like I said, primarily an operative rotation. And you get first pick of cases. If there are 2 rooms going on, you get to choose which room that you want, especially if it's a bigger case that you want to do, you'll get to do it. We have bread and butter stuff, orchiopexy, circumcision, stuff like that. We have not bread and butter stuff, things like really complex hypospadias, different sorts of reimplants and augments and stuff like that. So really you get kind of everything here. And like I said, in 4th year, it's really the time that you get to hone your operative skills. You really develop as an open surgeon during that year, and it's a really fantastic operative experience. So welcome to our children's hospital.
Next up on today's tour, we'll be making the drive from our main university campus over to Iowa River Landing. This is the only teaching site located away from the main university campus while residents rotate on the university service. It's an outpatient facility located in Coralville, Iowa, just off of Interstate 80. Offers a nice, convenient, modern location for our patients to be seen. Primarily our 1st and 2nd years that are spending time here kind of honing their basic clinical skills. We're located up on the 5th floor, and this will actually be the last stop for today's tour. We hope you enjoyed your time and got to get a better idea of why we love our facilities here at Iowa so much. Thanks so much.
Hi, I'm Alana Bergelson. I'm one of the new urology interns, and I'm here at the Iowa River Landing site, or as we like to call it, IRL. At IRL, you have a full day of clinic where you get to work one-on-one with the staff. In addition to working with the staff, we have a huge team of advanced practice providers, which include nurse practitioners and physician assistants. This allows us to see many, many patients throughout the day and also learn from them as they're part of our growing team. We also get to do procedures in our procedure room, including cystoscopies, as well as anything else that might come up